My name is Charles Evans. I'm the Clinical Systems Administrator for Genesee Orleans Council on Alcoholism and Substance Abuse. I've been using Cerner for 7 years. I think for us the greatest point is when my clinicians sit down, they don't have to go through a chart, they don't have to fumble through what's going on. They can pay attention to their client while all the information is just sitting on a computer. You know, their ability to do concurrent documentation while working with a client, knowing that it's going into the chart, or being able to look up information when the last toxie was, when their next service is, when their individuals are, they're being seen on a regular basis, what the outcomes for the treatment plan, if they're being accomplished, all right in front of them, not having to go from one screen to the next, not having to go, you know, through paper where we came from prior to this. I think the greatest benefit for us right now administratively is the QA process that we can utilize through Cerner. The ability to take my quality indicators and run reports on 9 of the 12 quality indicators, do 100% utilization review, and I think it takes me about 10 minutes, you know, to see where clients are at, you know, what courses of treatment are working best for what population of the client, so we can work on outcomes, especially for pay source information. Take a look at, you know, what trends are coming in terms of how many people with what diagnosis. It's all a single report away. So the ability to take that information and then modify our course of treatment to be able to help the clients get a little bit better. Second part is, and the bragging part is, we had a Medicaid audit and we had to pay no money back. So we had less than 1% error rate in all of our charts. Obviously, it comes down to our clinicians offered good care and did good documentation, but the ability to pull that documentation, to give it all in a single report to the Medicaid auditors and say, okay, here you go, wide open, and because we can, if a visit's no good, it doesn't go out the door, it doesn't get billed.
We've been using the Cerner Community Behavioral Health Solution since 2002. So we've been with the product a long time. From the beginning, we were an ASB customer, which means our data is hosted, and that's extremely beneficial and helpful to us because we're not a large organization, and we wanted to make sure that all of the security decisions that had to be met in a HIPAA world was met in a secure a manner as possible. And actually, since Cerner has acquired this solution, we're now in an incredibly secure setting in Kansas City. So that's an incredibly value-added benefit to using the product. The other thing I can speak about is that using the solution has really helped us to position ourselves not only in past projects but also looking to the future. The healthcare world is transitioning very rapidly because of a variety of market forces around the Affordable Care Act, looking to contain costs in the United States in general around healthcare, the healthcare delivery system. And in my neighborhood, which is located on Long Island in New York, we are aggressively moving forward in redesigning our healthcare community through the relationship with our local medical center, which is Stony Brook University Hospital. And they're also a Cerner customer. They use Cerner Millennium, or what I like to call Big Cerner. And because they use that for their primary healthcare and variety of physical healthcare lines of business, being a community behavioral health partner in the expansion through DSRIP funding and also establishing a PPS system. Behavioral health care is a very important part of helping to contain costs within population health management. And I know that the marriage between Cerner Community Behavioral Health and Cerner Millennium is the way of the future, and being able to have that seamless platform with our local PPS and local university medical center is just incredibly advantageous for us.
Hi, I'm Don Poole. I'm with the Resource Center in Jamestown, New York. I'm the Business Operations Coordinator for Behavioral Health and Care Coordination. We've used Anasazi for about 3 years. It's really been great. At the time, it was the only thing. We have a program called PROS, which is an intensive rehabilitation program, and Anasazi was the only software at that time that would handle our complex billing issues and be able to actually track patients the way we wanted to.
My name is Lisa Volo. I'm Director of Behavioral Health Services at Human Technologies Corporation in Utica, New York. We've been with Cerner since 2012 was our go-live date. At that point in time, we had implemented the first stages of Anasazi, now Cerner. The reason we got on board initially with our partnership with this software is due to compliance. We had a significant problem with figuring out ways of getting lists in place for what treatment plans were due at what times. Staff were struggling with that information. So we started looking into software programs, and here we are today. We went from a 73% compliance failure rate to now a 0% compliance rate with treatment plans. So we're very excited about that. The other piece of this was that it improved clinical practices, so the staff were very supportive of this software program because there was a lot of redundant information that was needed to be filled out in paperwork in the paper-based system. The staff loved this system because it does pull forward all of that data and demographic information. So it has sped up clinical practices and employee morale. So we're pretty excited about this program and glad to be here today.
My name is David Parisi. I'm an EHR specialist at Mid-Area Counseling and Treatment Services. I'd like to just talk about the electronic prescribing of controlled substances through the Cerner system. There's been some excellent enhancements to the system for the electronic prescribing of controlled substances, or the ECPS. Namely, the usability part was very noticeable in terms of the upgrades that have been made to the system. For prescribing non-controlled substances, they made the interface very easy to use. Our doctors now, with very few clicks, can send scripts to the pharmacy, and they can manage both the controlled and the non-controlled from the same page. So these have been some excellent upgrades to the system. Our doctors have been, and all of our prescribers have been very pleased with the usability and the upgrades that have taken place with the latest changes to the prescribing module. So, and it's a big deal when you have a very busy med clinic that things can be done very quickly and efficiently.